when I got better, okay, and you should see me, Hero was talking when I came out of the ETU, I had my hands in the air. But I had seen before and heard before when Dr. Kent Bradley walked out of the ETU in Emory, everybody was high-fiving him. Yes, look at him, I walked out of the ETU, that's the pops got up in his white boots behind him. Okay. Look at the periphery. Everybody, my own good friends, they were crying, but they were running. They were running away from me. Now, in this picture, I look a little bit strong, right? If I tell you that those were my best steps I was taking at the time, you wouldn't believe. I was dying then. I was Ebola negative, but all my entire body had been drained. Okay? That is the most vulnerable point in the Ebola survivor's life. The point where he crosses from being Ebola positive to Ebola negative, he is still very vulnerable, okay, to all kinds of sicknesses and death. I had a very good support package, okay. The GFK team sends the psychosocial person, Honorable Smith, he was at the house talking to me, Ministry of Health, and I would say this on tape. They send some rice, some oil, some Clorox to my mother, and they give her a blank piece of paper. The man that carried, not the Ministry of Health, but the man that carried the sheet to her, gave her a blank sheet, said, sign the paper. And the woman said, but I'm not like that. I don't know what I'm signing for. You will write all these items down, write them down, go and print them out, and I will check them that they're here, and I will sign for them. And then he went back and did as she said. Okay. And then he came back and she checked it and then decided. Okay. Because the 419 activity and the DDBA that went along with this whole epidemic is colossal. Okay. That's why I thank God, and I hope we persevere. For us to make things right in our country, we have to give more than we take. Okay. We have to give more than we take. I came out of that place and I was dying. Okay. And it took a lot of support. Emmett Dennis and his wife, the president of the University of Liberia, sent me about all kinds of vitamins. Okay. Dr. Kanakasabi, Dr. Tutu, and Dr. Pesa, they all, and Dr. Williams, they came to the house and they brought a whole lot of additional vitamins. They took care of me, my daughter, and my wife. They nursed me back gradually into health. After 15 days, I played frisky and I said, I'm going out because I want to go around. And I didn't drive. My wife drove me to Central Town and back. I was bedridden for 2 days. I didn't leave the bed. I'm still recovering as I speak. And I'm saying this to say there are now a lot of other people who have survived, but they don't have that support network that I have. That's why some of them died after becoming Ebola negative. That's why some of them are still suffering right now. When you have had Ebola, sometimes the complications are different. Sometimes your brain doesn't work the way how it should be. So you can't go back to work. What happens to you? What happens to all the orphans? We, as Liberians, need to regain our humanity. Let the heroism and that spirit of progress get back into us. Let us give more than we take. As I close, we have huge challenges ahead across the globe. Okay. Like I said, we have epidemiologists, we need more epidemiologists, more public health specialists. Okay? The way how an epidemiologist thinks, the way how we think, is like this. If you hear Ebola is in Guinea, Lord have mercy. You already know it's in Liberia. You set up shop at the borders. All the things that we are doing now, that's what our professional was supposed to be doing back then. Okay? Prevention is less costly and is far more better than cure. Okay? And that's what public health is all about. We failed miserably, okay, in this epidemic. But I'm happy to say we recovered from that failure and corrected ourselves very quickly also. So we do have that capability. I will stop here now. I've said enough. And thank you for